morning and welcome to a special edition of the Balancing Act Presents Behind the Mystery. I'm Montel Williams.
And I'm Olga Villaverde. Today we're going to be discussing an autoimmune blood platelet disorder that affects your body's ability to clot blood, causing an increased tendency to bleed, sometimes spontaneously.
Wow. We'll start with Brenda, a wife, a mother of 4, and a rare disease warrior.
A couple days after Thanksgiving of 1999, I woke up, and when I looked in the mirror, I was shocked at what I saw. All these red dots all over my body. First, I thought maybe it was just a rash of some type, but when I turned around and looked in the mirror, I saw them all on my back. They were on my legs, everywhere. So I was like, something is just not right. And when I got to urgent care, I saw the doctor. He took some blood work, and then he came back in and he said, "Ma'am, you have no platelets. You need to go to the hospital. I'm calling the ambulance. You cannot drive, get in an accident, and you could possibly bleed out." I think I was just in shock. And it didn't really hit me until I actually got to the ER.
Dr. Terry Gernsheimer is a professor of hematology at the University of Washington and specializes in immune thrombocytopenia, or ITP.
So ITP is a disorder of platelets where the platelet count gets lower than it normally would be. In ITP, the patient begins to make antibodies against their own platelets and attacks their own platelets. Platelets are an integral part of the clotting system. So you can imagine that if there are fewer platelets, it means that you're going to bleed longer. You can even begin to bleed spontaneously. ITP can be mild, in which case there just may be some excessive bruising. When they brush their teeth, there's a little bit of gingival bleeding. A woman who gets her period might notice that their period lasts a few days longer or is heavier. Petechiae, which are little tiny amounts of bleeding into the skin. Sometimes it can be a spontaneous nosebleed. Fatigue, and the fatigue can be debilitating. Researchers in ITP got together and divided ITP into 3 categories: acute or newly diagnosed, 0 to 3 months. Between 3 months and a year, we call that persistent, and chronic, over 12 months, lasting years or sometimes decades. Some patients with ITP are asymptomatic. They haven't noticed anything different, and they come in for a routine blood work for some other purpose, and a low platelet count is noted. Other patients come to the physician themselves because they've noticed that they're bruising more than they expect, they've had nosebleeds, petechiae, and at that point, a blood test is done, and the low platelet count helps us diagnose ITP. But there is no specific test, and generally we have to diagnose ITP by ruling out other causes of a low platelet count.
After I got to the ER, I was assigned a hematologist that was on call that weekend. He came back and told me that I had, at that time they called it idiopathic thrombocytopenia purpura. He said it's called ITP for short. First, I believe they gave me platelets, and they checked me the next day. Still nothing. The doctor decided to try steroids, and after a couple of days, my platelet count actually went up. So when I was released from the hospital, I guess I just had not processed the full, diagnosis of having ITP. I don't think I gave myself time to really appreciate what was happening to my body.
More Behind the Mystery when we come back.
Welcome back to the Balancing Act Presents Behind the Mystery of Chronic Immune Thrombocytopenia.
The doctor gave me a prescription for the steroids. So I was on that dose for 6 months. So the steroids did their job, but I couldn't sleep at night. I gained weight. I had the moon face. I was in a meeting one day, and one of my employees, after I made a comment, he said, "Well, who are you?" And people were saying, "That's Brenda." And that hit me really hard. That was one of the worst days I ever had. Outside of the side effects of the steroids, the ITP itself caused fatigue. I'm a wife, I'm a mother, I had a federal job. I'm used to being the one that does everything. So to just take a step back was really hard for me. But then I found out on the other side that I had people that cared enough for me to help me.
So ITP is a rare disorder, which means that a lot of doctors know about it, but may not be expert in treating it. And so it is appropriate to seek out someone who is expert in platelet disorders or in hematologic disorders specifically, who may be spending more of their time investigating the causes and the newer treatments of ITP. Early on in newly diagnosed ITP, it's very common to be treated with corticosteroids or with IVIG, intravenous immune globulin. If one finds themselves requiring continued use of steroids in order to maintain the platelet count, it's important to seek advice from someone who is expert in the treatment of ITP to see if there are other options. For a patient who has a continued low platelet count, there are two ways we can approach this. We can use a TPO or thrombopoietin receptor agonist, which makes more platelets grow, makes the bone marrow make more platelets. And the other is to suppress the immune system. And immunosuppressive therapy is used to quiet down the immune system that is attacking the platelets. Another option is surgical removal of the spleen. This has become much less common and less popular as we've developed other options for the treatment of ITP that does not require surgery. There are several things we have to take into consideration with our goal of treatment. We have to certainly consider the platelet count and whether or not it's safe for the activities that a patient wants to undertake. We also have to consider the side effects of the therapy, how often the therapy needs to be given, and what kind of anxiety the patient may have around their own platelet count. We also have to discuss diet, since sometimes diet can actually interfere with some of these medications, and there may have to be adjustments in the diet in order to take that medication.
So after being in remission for a few years, I went for another checkup. My hematologist said, sorry, you've got to go back on steroids. I was so deflated. You know, things were going well. Here I was being told that ITP was chronic at this point. This was something that I was going to have to get used to, and it was going to be a part of my life.
For the rare disease community, advocacy, support, and access to innovative treatments can really make a world of a difference.
Absolutely. They can impact both the physical and emotional well-being of patients. Let's meet two leaders that are making a difference for the ITP community.
My husband and I had gone to a family wedding, and we were dancing, and we were having a good time, and he looked down and he said, "What's wrong with your feet?" And I looked down, and it looked like I had a rash from the tops of my feet all the way past my ankles. And then I bumped my arm, and within a few minutes, I had this golf ball-sized bruise sticking out of the side of my arm. And so I called the doctor, and they had me come in for some blood work. And after that, that's when I got a call at 3 o'clock in the morning from the doctor telling me that I had a very low platelet count. So the doctor said to me, you need to come to the emergency room immediately. That experience started my journey with ITP and led me to PDSA.
I'm Glenna Shen, and I'm the Vice President for Corporate Affairs at SOBI North America. I oversee a variety of things, including communications, external engagement, and patient advocacy. The work I do is so important because as robust as our healthcare system is, we're still lacking in truly good access to healthcare and, more importantly, access to information about your healthcare. And this is particularly true in the rare disease space. So for me to be able to do this work in partnership with patients and family members is truly purposeful and, quite honestly, is an honor.
When we come back, our exclusive in-studio interview with Caroline and Glenna. Stay with us. Welcome back, everyone. Joining us in the studio is Glenna Shen, Vice President of Corporate Affairs at SOBI, and Caroline Cruz, President and CEO of the Platelet Disorder Support Association.
Thank you both for being here this morning.
Thank you.
Welcome.
Thank
Thank you for having us, and thank you for wearing purple.
Yes,
the color of platelets.
Yes, we got the 411.
Well, Glenna, tell us a little bit about SOBI's commitment to the ITP community.
Sure. So SOBI is an international biopharmaceutical company specializing in rare and severe diseases, and we do have a focus on ITP. Our mission is to transform lives of patients and family members who have rare disease, and we do that through really trying to understand the individual experiences of these patients and their families, because that way we're best able to support their very unique needs. In the advocacy space, we partner with many organizations, including PDSA, to keep moving the work forward.
That's fantastic. So how does SOBI address the variety of patients' needs? Because everybody's needs are different.
Yeah, absolutely. The journey, as you've heard from both Caroline and Brenda, is tremendously challenging. And so we really are trying to help alleviate that burden. So in the advocacy space, we partner with our organizations really primarily to create educational resources, not just for the patients and their families, but also for the providers, because we really are interested in facilitating open, informed, and empowered interactions, because I think that's really how we make sure they get the best care. We also are very supportive of making connections between newly diagnosed patients and these advocacy organizations. Early in the journey, sometimes it's difficult to find other people who've had the same experiences, and there's nothing like the support of a community to get you through something like a rare disease diagnosis.
We heard a little bit about your experience with ITP. Tell us how that has impacted what you do for PDSA.
Well, I certainly understand what patients go through physically, emotionally, mentally. ITP is such a roller coaster, such an odyssey for patients. And while your family and your friends can be supportive of you, they truly don't understand what it's like to have a rare and chronic disease like ITP, like another patient does. And we make those connections for patients and for families.
So what type of resources can a patient access on the website?
So pdsa.org is really the most comprehensive resource for ITP. We have more than 200 pages of information. We have treatment tables. We have research guidelines, 63 local support groups across the US and Canada, and we have a national patient conference each year.
Wow. I'm just curious, how has working with pharmaceutical companies evolved over the years?
When I started with PDSA 18 years ago, we received support from our industry partners for our programs, but we really didn't engage with them. And now we engage with them early and often on clinical trial design, because the FDA wants to understand clinical endpoints that are important to patients. So while ITP is a bleeding disorder, it also causes debilitating fatigue. And so those clinical endpoints are incorporated into clinical trials.
Why is it so important for a company as big as SOBI to engage with an advocacy group?
Look, at SOBI, we're here to serve our patients and their family members, and we can only really do that if we understand what they need. The most important and impactful work we do with PDSA is working with Caroline and her team, and through their team, working with the patient community to understand what their ongoing concerns are, what their needs are. And that really impacts how we do our work at SOBI, everything from medical research to making sure that we bring a product to market that actually meets the right needs.
What are some of the challenges and rewards that you've already seen?
Gosh, one of the biggest challenges I have personally, but also for SOBI as a company, is that sometimes even after you found and identified a challenge, there is no answer. There's no short-term better even. And as a company that works with urgency, that can be a little frustrating for us. We have to lean into a little bit of patience. But on the converse, the rewards are such that, every incremental step you can make in improving these lives is so important and so impactful that it offsets, I think, any challenges.
Caroline, your thoughts?
I think the challenges are making sure that patients know that these resources are out there and connecting them with physicians who are experts in the disease so that they're getting the correct care and the correct information from physicians. And it's difficult to see patients suffer for years and years with a rare and chronic disease. But the rewards are seeing how we're able to help these patients and families.
Thank you so much for being a part of the show today, honestly.
Thank you, guys.
Thank you for
Truly
having
great
us.
information. So appreciate it. And more with Brenda and Dr. Gernsheimer after the break. We'll be right back.
So after about 6 years, I was assigned a different hematologist. He was much younger and I believe a little bit more aggressive, very much into research, finding out what he could do to help me. He had spoken with an ITP expert and they recommended another form of treatment. And at that point, I did agree to the infusion. I was just so excited just to have a different form of treatment. It's important to have an open dialogue with your doctor and to also be empowered to be a part of that decision-making process and to advocate for your best self.
I think it's important for patients to be partners with their doctors when discussing their illness and deciding on treatment. Ask your doctor about the different treatments available for ITP and to be able to discuss with them which treatment fits your case the best. I encourage my patients to look into the Platelet Disorder Support Association. It's a great place for them to get information, and I think it's very important for patients to empower themselves by joining PDSA.
When I found the PDSA, I was just super, super excited. Just being able to chat with someone who knows what you're talking about, it's just a marvelous, marvelous feeling. There was a conference in Arizona, so I talked to my husband about it and I said, how about we go? And it was one of the best decisions we've ever made. Because when I got there, I found my people.
It has really been my privilege to be taking care of patients with ITP. Since I began practicing medicine and saw my first patient with ITP and realized these were patients who really would benefit from the research I did both in the laboratory and in the clinic. And I am so fortunate to have been able to both enjoy working with the patients and enjoy the research that I've gotten to do.
Like that song says, how I got over. My soul looks back and wonder how I got over.
Yes.
But we did it.
Yep.
Did it together. I've had ITP over 20 years at this point. It still is a little anxiety when I go to the doctor for my blood work, but I don't sweat the small stuff anymore. And I learned that information is power. And I also learned how much I was loved by my family, my coworkers, my friends. That's what life is supposed to be. Don't focus on the negative, focus on the positive, and life will be what you make it.
Thank you all so much for watching. The Balancing Act presents Behind the Mystery of Chronic Immune Thrombocytopenia.
For resources and support on ITP, get in touch with the Platelet Disorder Support Association at pdsa.org. You can also visit sobi-northamerica.com.
And as always, you can check out our website, thebalancingact.com. We'll see you next time.